So the MAIA study is one of the larger contemporary clinical trials that have been done in newly diagnosed transplant-ineligible patients, originally reported and published about 2 to 3 years ago. This study looked at the standard of care arm of RD being given continuously compared to Dara-RD on the experimental arm. And the study had originally read out positively in terms of its primary endpoint of PFS, and now has a follow-up of about 5 years. These data are being presented as a late-breaking abstract by my colleague, Dr. Thierry Facon, showing at the 60-month PFS at 52.5% for DRD, and for RD at 28.7%. So the median PFS has not been reached for DRD, whereas it's 34.4 months. Then, PFS2 at the 60-month mark, very similar kind of trend, not reached for the DRD arm, and it's 60.8% at the 60-month mark and 41.6% for the RD arm of the study. And then for the 60-month OS, it's 66.3% versus 53.1% on the RD arm, with a hazard ratio of 0.68, meaning statistical significant, with a p-value of 0.001. And then, looking at the OS benefit, it was generally consistent across all patient groups. So, interesting and exciting data, the PFS benefit obviously being confirmed, but the OS at the 60-month mark after follow-up showing benefit in favor of the Daratumumab containing arm of the study.